You can kind of see how small I am right now. So hopefully we can find a great size. I have my mom here with me.
Hi, I'm the accomplice.
She's my accomplice. Why am I so excited for my pre-op appointment? Well, I have constricted breast. So in a nutshell, they are narrow, have less distance between the nipple and the breast fold, and don't have the lower and side curvature of the ideal breast shape. I spent countless days looking through hundreds of surgeons' constricted breast augmentations before and after pictures with no luck. That is, until I found my surgeon's website. You see, I wanted to find a surgeon who could use a round implant with a smooth shell to achieve the teardrop shape. My surgeon is an expert when it comes to this. Needless to say, I am so excited to meet with him today and to take one step closer to achieving the ideal breast shape. So without further ado, let's get into my pre-op appointment, shall we? Hello, so I'm here with Dr. NINI. He's going to do my breast augmentation and he's about to do my examination.
Okay, let's open this up.
Thank you.
Okay, you put your hair behind your shoulders for me.
All right.
So Amber, when I examine her, it looks like she's carrying her left shoulder higher than the right. And as a result there, her left inframammary fold is about 1 centimeter higher than the right. And the left nipple is a little higher than the right. Her base diameter is really about 12.5 centimeters on either side. And she has a lack of outer fullness of the breast. There's no outer curvature of the breast. Her tissue the glandular tissue feels quite soft, and so I don't think that she's going to be at a significant risk for a double bubble formation. But I do think the best thing to do is place that implant under the muscle. Volume-wise, she has symmetry. I don't think there's enough of an asymmetry to really warrant placement of a remote port. And I think that if you want to be a C cup, I think your texture is such that we could probably just go straight to a saline implant.
Oh, wonderful.
Yeah.
Oh, thank you so much.
Yeah.
I'm so excited to hear that.
Yeah.
And I found you and I was like, wow, your before and after pictures are so beautiful. What I love is that there's like a teardrop shape. I love that.
And that's the ideal breast shape. That's what we're trying to create. Okay, sort of a straight slope on the top and then a nice lower hemisphere curvature. I have found the greatest success with using a saline implant under the muscle.
Okay.
Now I'm going to tell you that 99 out of 100 augmentations we do are going to be with a silicone device. So using there are just a few really important criteria which make me move to or recommend a saline device, and constricted breast is just one of them. I feel confident your breast shape is going to be much improved.
Because a lot of what I see is maybe they'll have a YouTube channel and they'll talk about how they'll form the breast to look like beautiful and round and symmetrical. But whenever you look at their surgeries and before and after pictures, it'll look like what they call a Snoopy boob, they called it, where it would like fold and loop down, like not good at all.
That sort of Snoopy deformity that you probably
Yeah,
I haven't heard that in a long time, but
Okay.
I know what you mean. So sometimes if the implant isn't large enough, what that is, it's almost like a waterfall. It's like the glandular tissue in the breast is falling over the implant like a waterfall. So one of the things that we have to do to make sure that that doesn't happen is release things internally just a little bit to allow the breast tissue to really take the shape of the implant so that waterfall doesn't occur.
Okay. Is under the muscle the same thing as partially under the muscle?
Yeah, I mean, years ago, surgeons tried to get a full muscle coverage of implants. I don't think anybody's doing that anymore. So they're all partially under the muscle. If you put an implant under the muscle, the natural thing for the muscle to do is window shade up when it contracts. And so the dual plane is we just separate the muscle from the overlying glandular tissue just a little bit to allow that window shading to occur a little more rapidly. It's going to happen one way or the other.
All right, perfect.
Perfect.
I have a lot of questions. I don't know when it would be appropriate to
We can
go
go through
over
them now.
them. Okay.
Because I can go through them really
we
fast
may
when I'm
have-
reading.
Okay, sounds good.
Symmetrical breast, I think volumetrically you'll be pretty symmetric. Would like to achieve an hourglass look as much as possible while looking as natural as possible. Now, what do you mean by an hourglass look?
Whenever I look online, they say hourglass is whenever like your torso kind of goes in and your hips and your boobs kind of go out.
Yeah, so this is, what my aesthetic ideal for a woman is. You've got a bump from the shoulder, a little bump from the breast, the waist comes in, and a little bump from the hip. So
Yeah.
there's three curves that I'm thinking about.
Okay.
And so when I looked at you and I said that you really didn't have that lateral or outside breast curvature, so you're going to get that.
Okay, good.
That's going to happen.
Perfect.
So we'd like to be a C cup. Yes. So
Yeah.
you have good shoulder for it too.
Okay.
Pictures that of patients who had a moderate plus profile. I think, in terms of volume, you're wide enough. That's probably the appropriate thing.
Okay, great.
You like this patients who go with 400 cc's plus. It's very difficult to tell in 2 dimensions what the volume should be. So you'll look, and you probably have already done this. You'll go online and you'll look, this person is the same height as me, the same weight, the breasts look the same, but this one got 250 and that one got 350 and I can't tell the difference, right?
Oh, okay, yeah. That's
So that
true.
happens all the time because it's 2 dimension, and there's so many other things that are important. It's the volume of the native tissue, it's the position of the chest wall, whether the chest wall is square, sloping, what the ribs are like, because the ribs are the foundation, the chest wall is the foundation for the breast.
Oh, okay.
And so there are a lot of other things that go into it 3-dimensionally that make it very difficult to tell. So I wouldn't be stuck on 400 plus cc's because that just may not be the right volume for you.
Okay, sounds good.
Questions? What profile? A round implant, of course. What size of saline implants do you recommend? Well, we're going to go on base width. So we measured you at about 12.5 centimeters. I think is about the right size for you.
Okay.
And so there's a lot of latitude there in the amount of volume that I could put when I choose that implant.
Okay.
And so what we'll do is I'll adjust the volume to get the result we're looking for. A certain reason you use this brand of implants.
Oh, what kind of brand is
So,
it?
there are two brands that have stood the test of time in America, the Allergan brand and the Mentor brand. The Mentor has what I feel the diaphragm valve on the saline implant is probably as secure as any, so I like that one.
Okay.
And I think it's still made in Texas.
All right.
What causes some breast augmentation surgeries to have rippling in the cleavage area? If the rippling is really right in the cleavage area, that means that they probably put a saline implant. If it's over the muscle, too close to the really thin skin, because the skin over the sternum is very thin, right? There's nothing covering the implant.
Okay.
And if they did it under the muscle, that means they may have released the muscle too far towards the midline, and so you'll see that type of rippling there. I don't expect you're not at risk for that because we're not going to release the muscle that much.
Okay, cool.
Will you have rippling? If so, and where? Yes, you're going to have rippling on the outside of the breast. Okay, it's especially when you lean forward.
Okay.
Okay, so that's where you'll see it, but you're not going to see it in the upper poles of the breast at all. Is there a difference in feel between saline and silicone? Yes, there is. I think that difference will probably be most noticeable to you feeling the lower outer aspect of the breast mount.
Okay.
You're probably not going to notice much difference in the upper poles because it's covered with the muscle too. Do you find there more capsular contracture with silicone or saline implants? I go to great lengths to try to prevent the implant from touching your skin or touching a glove or an instrument that has ever been in contact with your skin.
Okay.
So I think in my experience, the incidence of capsular contracture is the same if you follow the patients long enough out.
Okay.
I do not think that one brand of implant has less risk of capsular contracture. How long can it occur? Almost at any time. Typically, patients are 6 months to 18 months out after surgery. What steps can you take to reduce the possibilities? I don't know that there's anything that you can do really to reduce that, but mostly it'll be up to me and then how your body reacts to the foreign object that's in it.
Yeah.
Have you had patients that have had breast implant illness? So I've had 3 patients that we've removed their implants because they thought they had breast implant illness. One patient ended up with fibromyalgia. One patient, and it ended up that she had heavy metal toxicity. We didn't know. Another patient was on the wrong thyroid medication. She should have been on Synthroid. She was getting Armor thyroid, and she had a lot of symptoms as a result of that. We took her implants out. Then somebody changed her thyroid medication. All of a sudden her symptoms went away. Then she came back and we put her implants back in.
Oh, okay.
Right, exactly. Those are my 3 experiences with breast implant illness. Although I do believe it's probably a real entity and probably really happens, but I think it's probably, the incidence is probably a lot less than you hear people talking about on social media.
I was wondering, I was like, maybe it's not as big, because I've asked some people that have implants and they've not come across that, and then when I did read about it, some people think it's because silicone is made out of silica, which has metals, and maybe it has to do with this toxicity of metals in your system, and that's why I was thinking saline might be, maybe they have less, I don't know.
Well, you know, both of them have a silicone rubber elastomer shell, so.
Yeah, but that's one thing too, they were like, you can't get away from it, but I was like, I wonder if there's, just because there's more in silicone.
Yeah, so I guess in order to figure that out, you'd have to take that population of patients and, you know, study their chemistry and see whether they have any detectable heavy metals.
Yeah,
you know.
That's true.
Allergic to Band-Aids, allergic reaction to implants. To the material, probably not. You know, this medical grade silicone's been used for decades and decades and decades, so I don't think you're gonna have an allergy to that.
Okay.
But we'll put a little steri-strip on your arm, because typically we put steri-strips on the patient. So before you leave today, we'll put one on your arm just to see if you develop a reaction. No, saline implants do not come pre-filled. We have to fill them with a closed system after they've been inserted. So what technique do you use to keep blood or bacteria? So when we do the surgery, when I do it, it's very hemostatic. In other words, we're not going to see much blood at all. I mean, if you lose a tablespoon, that would be a lot. Okay? A teaspoon,
that's
maybe,
wonderful.
yes, not much at all. And then we're going to rinse everything until it rinses clear.
Okay.
But the other issue is the bacteria. So typically what I'll do is I will cover your skin with an adhesive iodine impregnated piece of plastic film, and we'll make a little slit in the film where the implant goes in, and that'll all be done with clean surgical gloves, new ones, clean instrumentation it's been put aside just for the insertion of the implant. And then when we insert the implant, we'll make sure that it doesn't come in contact with your skin at all. So there's so the risk of having, for us, transmitting bacteria from your skin, even though we prep it, there's still a lot of live bacteria on your skin. So the risk of us, you know, of that contaminating the shell of the implant and putting it in the pocket is very low.
Good, that's wonderful.
I can't quantify it, but I know it's very low.
I've heard of certain facilities, and very few, that have a certain machine where not only does it filter the air, but it like kills bacteria in the air. I don't know if it's that common here.
We actually do have one of those machines. It's a they call it a robot. It's got all these sort of UV lights on it. It's super powerful. You can't even be in the room with it. But they use that to terminally clean the rooms each day.
Oh, that's wonderful.
That came about during COVID.
I'm so excited to hear that.
So we talked about filling. We talked about the technique. We talked about where the incision is. It's under the breast. Is it covered by the breast fold? Yes. If I have children in the future, we'll be able to breastfeed. The answer is yes. It's entirely safe. The traditional teaching is that when an implant is under the muscle, there's a better opportunity for you to nurse successfully. But there's so many other things that go into it. Are you going to generate enough milk? Is the baby going to latch on?
There's so
does everything
many.
work? So what I tell patients is that typically it's safe to do, and you may not make enough volume to satisfy a baby, so you might have to supplement with some formula early. What items? Just comfortable clothing. Will you be prescribed medications? Yes, we will call them into your pharmacy or e-prescribe them today. Yes, you will talk to me prior to surgery. You'll also meet the surgical team.
Oh, beautiful.
What information will we double check? Everything. I mean, we'll review your notes and make sure the implants are in the room, but before you go to sleep. How long will the surgery take? Probably under an hour. In what room will your mom make? There's a waiting area for your mom. Your mom will see you probably, I'm gonna say maybe an hour after we're done.
Okay.
Will you be bandaged up? Not really. You're just gonna there'll be a surgical bra and you'll have 2 steri strips underneath the breast.
Okay.
The steri strips will stay on for about 3 weeks. Shower and wash up the day after surgery. I'm a big believer in soap and water over everything. Just clean the bacteria off and rinse them down the drain.
Okay, sounds good.
The side effects of anesthesia, mostly nausea. Patients have, yeah. And have you had anesthesia before?
I've only been put to sleep whenever I had my wisdom teeth taken out. I don't know if they use the anesthesia. I don't know what they use.
Was that done in a hospital or in a doctor's office?
In a doctor's office. And he shot something in me and I just fell asleep.
Yeah, okay.
And
So
when I
it's
woke up, I
probably-
was crying.
Probably
And so,
sedation.
okay. So that was the only side effect I had. I was like, I don't know why I'm crying.
Do you experience nausea frequently?
No.
Okay, so you're gonna be fine. I'm not
Okay.
worried about it. How should you care for the incision sites? You don't have to do anything but wash them with soap and water each day.
Okay.
Vaseline as a moisturizer, no. But once we take those strips off, I'll give you about a week of not putting anything on, and then we'll ask you to massage those scars, sort of daily with like Palmer's tummy butter. The women use that for pregnancy on their abdomen. Any moisturizer that agrees with you. You don't need to use silicone sheeting or anything. In my experience, just a good vigorous massage, okay? So where you really stimulate the scar maturation. With a good moisturizer, it's all you need
That's
to
a
do.
good question. Also, because you said the silicone sheets, I saw them online. Some women use them. They're like the silicone, little sticky thingies. Do you recommend those or no?
We've used those, for years, and I don't know, I was never convinced that they worked any better than massage.
Okay.
How about you, Amber?
Exactly.
No.
All right. Moisturization and massage is your go-to. That's all
Thank
you
you.
The first complication after surgery is a hematoma, if there's
okay.
bleeding or something like that.
Okay.
And what would happen is one breast will become much larger than the other, and it'll be very painful. If that occurs, we're going to bring you to the emergency room, and we'll take you down and rinse everything out under anesthesia. I'm a big believer in doing that immediately.
Oh, okay. Good to know.
Typically, it's not a threat to your health, okay, but it's very uncomfortable. And if we leave the hematoma there, even if it's a small one, you're probably going to get capsular contracture.
Oh, okay.
So it makes sense just to get rid of it.
So if that happens, because the surgery's on a Friday, would it happen
Friday night.
Friday night? And so would I contact the office? I don't know if anyone's available.
Yeah, you'll just call the service and they'll text us.
Oh,
Let
okay.
us know. And it is super rare, okay?
Okay,
So
good.
I don't want to make you worry about that. You can use regular soap after the operation. When do you recommend you shower? Well, for up to me, I'd let people shower the same day as surgery, but traditionally we let people shower the following day.
Okay.
To be fully healed, I think you're pretty bulletproof in about 6 weeks.
Oh,
Yeah.
okay.
So you're going to be staying around after surgery. You're going to come back on a Monday. Your surgery's Friday. We see all Friday patients on Monday.
Okay.
Yes, there's a way to schedule to come back whenever you want. How many post-op visits? As many as you choose.
All right. Okay.
We have an open door
Thank you.
policy when it comes to that.
When we were talking to Elkie, she was thinking maybe on a Thursday I could come back. But since you're recommending a Monday, could we do maybe Monday and Thursday right before
Sure.
just to make sure?
Yeah, absolutely.
Oh, thank you. Well, thank you.
All right,
You answered
super.
all my questions. I appreciate that. You took a lot of time with me, so thank you so much.
Okay. All right, good. I hope your film works out great.
Yes. Oh, I'm sure
Good for
it
you.
will. Whenever I do start my channel and then I have it up, I'll definitely let your office know if you would want to see it, because I'm like, there's a lot of women I'm sure that deal with this. And it's been such an interesting, I just thought I would have to meet a surgeon and it would be as easy as like, oh, you just need this implant and it'll look fabulous. It's not like that. You have to pick a good surgeon that knows how to make that beautiful shape that you want. So it feels like from all your before and after pictures, I know it's gonna look beautiful.
Well,
Yeah.
from your lips to God's ears.
How many cc's will I go with? Well, although Dr. NINI will decide on the day of surgery based on my aesthetic goals, I thought it would be fun to try some sizes with you today.
How does it feel with the 300? Does it feel too small or does it feel too big?
It looks good. Let's just see how it looks a little bigger.
I'm gonna go.
Chest, it'll all look different. Oh, that looks
I
nice.
think I like that one.
Yeah, I think so too. 350.
Wow, it's not even 400 and it looks good.
Just in case when you are in surgery, if he feels like the 400 would look better, he'll put in like, you know, he'll kind of like base it on everybody's opinion to see what looks best on you.
Good.
Yeah.
Thank you. Yeah, but 350 looks good, I think.
350 looks good. Do you agree, Mom?
Yes, I do.
Out of curiosity, that would be ridiculous.
No, that looks like you're gonna tilt over and
Too big. Yeah, I like the
350, right?
Yeah.
Okay.
Hey guys, so it's the night before my breast augmentation surgery. My surgeon, Dr. NINI, and his nurse shared that I should use antibacterial soap when I take a shower the night before and also again in the morning. So this is what they were so kind to give me. Am I nervous? Let's see here. Right now I'm not nervous. I'm more excited than anything. All right, I'm here with my mom and we are driving to the Care Surgery Center. I'm excited. So I'm in the waiting room right now. I'm waiting on, I spoke with the anesthesiologist and the resident physician here, and now Dr. NINI is going to speak to me. And we're just 9 minutes away from the time my operation is scheduled. It's scheduled at 10 a.m. So this morning I had to get ready by taking a shower with the antibacterial soap as well. And I haven't had anything to drink or eat. I had to stop eating and drinking at midnight. We're with Dr. NINI and he's going to mark me up before my surgery. We're going to have it today.
Exactly, and see that she's carrying her left shoulder a tiny bit higher. So I'm going to make a lot of marks on you, but these are not cuts.
Okay.
They're just registration marks, so I know when I have you straight up and down on the table. And she has a sort of a mild constricted breast. And for memory, folds are 2 different heights. This one on the right side is that height. The left is this height here. It's about 1.5 centimeters difference. This nipple's a little bit higher than that nipple. Look straight ahead. Don't watch what I'm doing because that's gonna.
Okay, good to know.
And you're gonna be in just a couple of marks there, so I can make sure I get the tops of the implants at the right place. So after surgery, you're going to go home in a sports bra.
Okay.
And there's going to be a piece of tape underneath the breast over each incision. They're glued on, they're waterproof. So I want you to take the sports bra off tomorrow when I get right in the shower. The other thing is, since we are going under the muscle, you may have some spasm in the muscle.
Okay.
So the best way to sort of help alleviate that over the weekend is to just slowly bring your arms up over your head, kind of like a jumping jack. Now, in the very beginning, you won't be able to do it. You only get this high, but as you slowly get up here, it's just going to put the pectoralis muscles on a little bit of stretch, and it's just going to help take the spasm out. And so you just do that every couple hours, whenever you think about it over the weekend, and by the time the weekend's over. You are going to take your antibiotics today and tomorrow. We'll probably stop them on Monday. So you're going to take them 2 times today. So we're going to give you a dose intravenously in the operating room. Then you're going to take 1 dose when you get to the hotel, and you'll take 1 dose tonight before you go to sleep. And tomorrow you take 1 in the morning and 1 at night. And then also I want you to shower tomorrow and get everything wet, because I want you to use soap and water over the breast, even over that tape. It's waterproof. That'll wash all the germs right down the drain.
Oh, perfect. Okay.
You shouldn't have any troubles at all.
All right. Sounds good.
right,
Thank
lovely.
you so much.
Anything else I can tell you? We did a lot of education last time in the office.
Yeah, no, you answered all my questions last time. You were phenomenal. I couldn't have asked for a better consultation, or second consultation, or what
pre-op.
Pre-op,
right?
exactly.
And your mom is in the waiting area?
Yes.
Okay, I'm gonna go say hi and tell her that you're in good hands. Okay.
All right. Thank you
We'll
so
see you in there.
much.
Right? They're gonna come give you your IV now. Okay.
Okay.
From there, I went into the most beautiful operation room, met the rest of Dr. NINI's really hospitable staff, and fell asleep in a matter of seconds after my anesthesiologist, Dr. Kim, administered the anesthesia. So I'm out. I am feeling well. They gave me some apple juice, and I also have some crackers. The operation room was so beautiful. Usually they're downstairs in a basement, but this one had natural light, so I really enjoyed it. So my mother has picked me up. There she is. It's such a nice experience waking up. I just woke up naturally, and there was a nurse there already supervising everything, and he was really nice. There was a lady that helped me come downstairs to meet my mother. Well, I'm feeling fine. I don't feel much pain. I feel a little bit of pain, but more like a really, like I did a very big workout, and you know how the next day you feel really sore. It's just a little bit more sore than that, and my throat's a little bit raspy because I felt really dry when I woke up, like my throat, but then they gave me apple juice, and I wasn't nauseous, so that was a good sign. Thank you for joining my Constricted Breasts pre-op appointment and operation day. Stay tuned for my next video where I vlog my post-op appointment and recovery. If you enjoyed the video, please feel free to give it some love, and if you would like to see more content like this, remember to subscribe by clicking on the bell. You are welcome to ask any questions in the comments below, and I'll answer them by creating a Q&A video. Alright loves, until next time.